Step 1. Check for danger. Look out for unsafe circumstances such as live electrical cables, fire, possible explosion, construction works, dangerous machinery or motor vehicle traffic, or poisonous gases. Check to ensure that the scene is safe for you to help. Step 2. Determine responsiveness. Tap the shoulders and say, Hey, are you okay? Step 3. Shout for help and activate the emergency medical services. Point to someone and say, please call 995 and get me an AED. Step 4. Open the airway. Open the airway by tilting the head and lifting the chin. Place the palm on the forehead and push it backwards in a single movement for adequate head tilt. Hold the forehead with one hand. Use the first two fingers of the other hand to lift the bony part of the chin upwards. This is called the chin lift. Step 5. Check for normal breathing. Look for the rise and fall of the chest, or listen for the sounds of breathing, or feel for expired air from the casualty brushing past your cheeks. If you are a healthcare worker, you may also do a pulse check. Step 6. Locate hand position and perform chest compressions. Run your middle finger from the lower margin of the casualty's ribcage till you reach the center of the lower end of the breastbone. Place the heel of the other hand next to the index finger. The heel of your hand is now on the lower half of the breastbone. Interlace the fingers of both hands as shown and lift the fingers off the chest wall. Straighten both elbows, lock them in position. Position your shoulders directly over the casualty's chest. Use your body weight to compress the chest by at least 5 centimeters. Push hard and push fast at 100 compressions per minute. Count loudly as follows: 1 and 2 and 3 and 4 and 5, 1 and 2, 3 and 4 and 10, 1 and 2 and 3 and 4 and 15, 1 and 2 and 3 and 4 and 20, 1 and 2 and 3 and 4 and 25, 1 and 2 and 3 and 4 and 30. Step 7. Do mouth-to-mouth breathing. Maintain head tilt, chin lift to keep the airway open. Pinch the casualty's nose with your index finger and the thumb. Seal your lips around the casualty's mouth. Give 2 quick and short breaths, each lasting 1 second. Release the nose after each breath. These cycles of 30 compressions to 2 ventilations should be continued until one of the following occurs. Number 1, an AED is connected to the casualty and prompts the rescuer to stop CPR. Or, the ambulance crew arrives and takes over further care of the casualty. Or, the casualty regains consciousness and is able to move his arms and legs spontaneously. The Singapore Emergency Responder Academy recommends the following standards as established by the NRC for the best performance of chest compressions. 1. The rescuer must be vertically above the casualty. Number 2. Compress at the rate of at least 100 per minute. Number 3. Each compression should be at least 5 cm deep. Number 4. The chest wall must be allowed to recoil fully. Arrival of the AED. Say to the CPR provider, please continue CPR. Check for possible dangers. Make sure there's no water, metal or flammable gas around the area. Move aside clothing worn by the casualty to facilitate application of AED pads. If needed, cut away the clothing. Turn on the AED.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now.
Put arms sideways and say, stand clear. Do not touch the patient.
Shock delivered.
We have now completed the demonstration on CPR as well as the use of AED. Please review the notes and the video again. We wish you good success. For more information on our training programs and certification, please visit the following website.